How is everyone?
You love a factory, press the right.
Oh, I love a medical stockpile. I'm very proud of this medical stockpile.
Please use the aircon this one.
That's true. That's true. Is everyone ready to go? Excellent. Well, today in Queensland we have 6,857 new cases of COVID-19. That includes 3,016 positive rapid antigen tests reported to Queensland Health. There are 50,522 cases considered active. We did 14,075 tests in the last 24-hour period. Tragically, in that same 24-hour period, 13 Queenslanders lost their lives to this disease, meaning the total number of deaths in Queensland is now 247, 240 of those since the 13th of December. 9 of those 13 deaths were in residential aged care, meaning that 127 deaths reported in Queensland are from aged care facilities, roughly half the total number of deaths. We have 732 patients in total in public hospitals, including 50 in intensive care. In addition, 67 patients are being cared for in private hospitals, including 2 in intensive care. Our double vaccination rate of over 16s is now 89.78. And if you are one of those 0.22% of people that we need to get vaccinated to achieve that 90% goal, please consider going and getting your second vaccination this weekend. 56.75% of the eligible population have received a booster. And again, we encourage all of those eligible for their boosters to go and get them this weekend. Today, we're coming to you from one of Queensland's medical stockpiles. We now have these medical stockpiles right throughout the state so that our health services can be assured that we have the PPE and other essential supplies that we need on stock and on hand and able to get to them when they need them. It is now more than a month since the Prime Minister declared that the Australian government would not assist Australians to access rapid antigen tests, that it was not the government's job and that the market would take care of it. And we still experience a shortage of rapid antigen tests in Queensland and in Australia, and that is what's driving many of the supply shortages and staff shortages that we are experiencing right across the economy, in grocery stores, in aged care, in other settings. And the Queensland government has been working hard to ensure that we have the rapid antigen tests we need for the public, for our healthcare settings, and importantly, for school students going back to school next week. And we have on order 32.5 million rapid antigen tests. 4.6 million have already been received. There are some delays at Sydney Airport, but we anticipate receiving roughly 1.2 million over the next couple of days. That is 100 pallet loads of rapid antigen tests. The pallets that you can see downstairs here at the stockpile will be distributed to schools and be available in schools on Monday. That's 250,000 tests ready here in the stockpile, being distributed into schools over the weekend to be available for the return to school on Monday. Chief Health Officer.
So sadly, we have 13 deaths to report today. 1 person in their 60s, 3 in their 70s, 5 in their 80s, and 4 in their 90s. 2 of these people were not vaccinated. 8 had received 2 doses of vaccine, and only 3 had received a booster. 9 of these were aged care residents. What I can say is that about 70% of Queenslanders above the age of 70 have in fact received a booster. So we are seeing a disproportionate number of deaths in older people who have not received a booster, and this is of quite considerable concern to us. Anyone who is eligible should be going in receiving their 3rd dose of vaccine. That's anyone who received their 2nd dose more than 3 months ago. should go ahead and get that third dose of the vaccine. So even as we pass the peak, this virus is going to be with us for a long time, and if you haven't been exposed to it yet, you will be, and this will be here for years. So please go ahead and get that booster, particularly if you are older. And when I say older, our immune systems probably change in our 40s. And our response to viruses change after the age of 40. Even if you are perfectly well and older than 40 or 50, your response to the virus will be different. And all I can think of is that those who haven't received their vaccine, their booster in the community that are older, think that they are otherwise well. They've had 2 doses. That's all they need. It's not the case. We know that third dose makes a big difference to your immune response. So I am concerned about the disproportionate number of people who are dying who have not received that third dose. It's very concerning. In our public system, we have 732 people in hospital being treated for COVID-19, which is a reduction from 749 yesterday. So those numbers continue to decline steadily as we pass the peak in the aggregate peak in Queensland at the moment. Now, there will be some areas of Queensland that still have not reached that peak, but we are certainly there in much of Queensland, particularly here in the southeast. We have 50 people in ICU, which is actually up slightly from yesterday, from 46, as we've mentioned previously. The intensive care admissions lag a bit over the hospital admissions, and deaths lag as well in time from the intensive care admissions. In our private hospitals, we have 66 patients reported to us who are COVID positive, being treated for COVID in private hospitals. That's down from 71 yesterday. So again, things are slowly but steadily moving forward as we pass this aggregate peak in Queensland.
Doc, could I just say, obviously you've been monitoring what goes on in other states. New South Wales, Victoria, we've seen that rate. I think New South Wales, correct me if I'm wrong, it's about 10,000 cases today.
Yeah.
Mid-January, when their health minister came out and said, look, we're going to have days where it's 20, 30,000. Are you quite surprised that it's at 10,000 now? And what do you see that New South Wales has done? Is the peak just passed?
Well, the real numbers, as we've said before, the numbers of positive tests don't really mean anything. We identified yesterday from the Gold Coast study that between 5 and 10, for every person that identified, I'll say that again, for every person who had a clear diagnosis of COVID-19 from a PCR or RAT test, there were 5 to 10 others who were not aware they were positive. So the published numbers of positives probably don't reflect the reality. Well, we know they don't reflect the reality. That's why hospital admissions are a more useful marker, even though they do lag a bit. The other useful markers we look at are things like the percentage of tests that are positive, which are coming down across Queensland slowly. Absenteeism in workforces like police force, healthcare, emergency services, logistics, all of that is declining in Queensland.
Is it a good thing or a bad thing that people are walking around? I know that the research is fantastic, but is it a good thing or a bad thing that people are walking around not knowing they have it? It's not great for the spread, but is it great for our shields, I guess?
That's a difficult question to answer. Let me say, I just want to clarify something about that yesterday. The people that had few symptoms, almost all of those who had few symptoms and didn't know they were positive were in fact vaccinated. And I don't think I made that point very clearly yesterday. And that's the reason why we are not seeing many thousands of people in hospital at the moment. It's because of vaccination. So the fact that we have large numbers of people infected and without symptoms is the product of the extraordinary vaccination program that has happened here. And the reason the impact on Queensland hospitals and in terms of mortality more broadly is as low as it has been in Queensland is because of vaccination. Make no mistake about that. In terms of, you're asking obviously a question about what the virus becoming endemic. Well, we don't want people. Our goal has always been to reduce the burden on hospitals. We cannot stop this virus from spreading. We know that. We know that everybody at some point is going to be exposed to this virus. Even if somehow magically you manage to avoid being exposed during this wave, you will ultimately be exposed to this virus. So our goal has always been to slow the spread of the virus, and clearly we have succeeded in doing that, to slow that spread whilst people get the opportunity to be vaccinated and specifically to get boosted. So in fact probably the only disappointing thing at the present time is this group of older people who have not received the booster. And we know there's plenty of vaccine out there. There are plenty of appointments out there. So there is this group of people, and we know it's only 30% of those over the age of 70 in Queensland now who have not received that booster. But please go and get that booster now.
Why is it taking so long to get to 90%? And then secondly, if the definition changes around fully vaccinated being boosted, what impact is that going to have? Is that going to mean people aren't going to be able to go to pubs and clubs and things unless they've had a booster?
Okay, so the first question was around the 90%. Look, I think there is a percentage of Queenslanders who are never going to get vaccinated. I think there'll be a small percentage, and at this stage I'm much more focused on that group who clearly have indicated that they want to be vaccinated because they've already had 2 doses, but for some reason they haven't got that 3rd dose. That's the group that concerns me. Whether we're close to 90%, so that's actually an extremely good target. Few of us would have dreamt months ago that we would reach that target. I was sceptical that we would reach 70% when we started this vaccination program. So we'll be at 90% in the next few days. The slight delay may be, I think we've mentioned previously, because of we think it's because young people got their first dose and then probably got infected after their first dose and are just delayed a bit until they're getting the second dose. But we'll reach 90%. I mean, that target is somewhat arbitrary. It is a very high vaccination rate by any measure. And in terms of any relaxation and restrictions, we're not looking at any relaxation and restrictions in pubs and clubs for the time being until we know exactly where this pandemic is going.
Around if the definition of fully vaccinated changes, is that going to mean immediately if you don't have a booster you won't be?
We haven't actually even looked or discussed that moment. I've read the same reports, but we haven't even addressed or looked at that.
What do you think is holding that group back who's not getting a booster?
I'm not sure. There are two seem to be this. There are the group in the residential aged care, and I'm not clear what's going. It's not clear to us what's going on in residential aged care and why a disproportionate number of people in residential aged care have not received the booster. Because let's get it clear, these are people who've already received 2 doses, so they've already indicated that they want to be vaccinated. So why the hold up in getting the 3rd dose is hard to understand. And that's why I'm so concerned about it. There is also this group in the community. There certainly are people in the community, older people, who have not received that booster. And I wonder whether they think they don't need it because they've had 2 doses. I don't know. That's a relatively small group, but we know that anybody who is eligible for that 3rd dose, if they've had their 2nd dose 3 months or more ago, should get that 3rd dose, because it really makes a big difference. It makes a huge difference to your risk of dying, of being admitted to intensive care, of being admitted to hospital. It's a big, going from 2 to 3 doses is a big difference.
Do you think changing that definition though around fully vaccinated would give people that incentive to go and get the booster?
It may do. I mean, it's not something we've addressed. It's not something we've thought about. There are complexities around doing that, but it's not something we've discussed or addressed yet.
Is there a huge need for a booster? Say younger people, if they've had 2 doses, they get the virus and they recover from the virus. Is there really a need for a booster?
Look, this question gets asked a lot. If I were younger and I had I would get a booster. I mean, I would want to be as immune as possible against this virus. Certainly, if you've had 2 doses, you're young, you've had the virus. We know you will mount a good immune response to that virus in the next few months. We know that. But if I were young, I would be getting the booster as recommended.
Deputy Premier, could I just ask? Throughout history, you cannot deny that any political party, either governing or not governing, that has constant adversity or pressure put on them would ultimately lead to the leader of that party falling on their sword. If we see, hypothetically, that this pressure continues on the Premier, will you take a run at the premiership?
No. all of the issues that have been raised over the last couple of weeks have either been referred to the appropriate organisation and investigated, or are in the process of being referred to an organisation and being investigated. That's the appropriate path. If anyone has new evidence, new facts, then they should too be forwarded to the appropriate entity. But just because the Leader of the Opposition stands up every day and throws mud does not make it true.
Is it a fair question though, Deputy Premier, to say, again, I'll use the example of Gladys Berejiklian and ICAP, there was an investigation. We see the CCC is investigating. If for some reason they find that the Premier cannot lead the state and the Premier must step down, if adversity will keep landing on her doorstep, it is a fair question to know, and I think Queensland deserves to know, if it goes that far, will the Deputy Premier take a run at the Premiership?
No, there is no matter that has been raised in recent weeks that is anything like the examples that you've used. All of the matters that have been raised have either been investigated or in the process of being investigated, and we will continue to defer to the appropriate institutions to investigate these matters and make findings, and that's precisely what has happened with all of the matters that have been raised, and it will continue to be our approach.
Do you have confidence in the way the Premier has responded to the matters that have been raised in the past week?
I think the Premier has been very fulsome in responding to all of the matters, and no doubt we will continue to do so. There have been claims that have been made, not all of which are true, and she has sought to correct the public record where we can. There are others where claims have been made, not all of which are true, which we cannot correct the record because they are currently being considered by other organisations, and it's their role to get to the facts, to get to the truth of the matter, and sometimes that means that our hands are tied behind our backs and we can't respond to the mud that David Crisafulli slings at us, but we will continue to answer your questions every day.
If the government's got nothing to hide though, why not hold a broader, widespread inquiry?
Well, because we have a Royal Commission into the government every single day. That is the CCC. That is the CCC's role. Their job is to investigate these matters every single day. In fact, to set up a new institution to do their job would undermine them. The CCC's job is to investigate all of these matters, and if anyone has new evidence, actual evidence, not just hyperbole and mud like the Leader of the Opposition, then they should refer that to the CCC.
But the CCC's role is to look for illegality. A lot of these claims aren't necessarily illegal, but they are cultural, ethical issues. So the CCC's not really going to find any wrongdoing because their scope is not broad enough. So do you see there's a problem in that these are cultural issues being raised?
Well, first of all, strictly speaking, the CCC's role goes beyond criminal. It relates to misconduct and other matters of integrity, but there are also other institutions that look at other elements of governing and of public administration, like the Integrity Commissioner, like our parliamentary committee. She remains in place, and of course we'll recruit a new one.
But she wants an inquiry. I mean, you say the Integrity Commissioner is the body. She's the one calling the inquiry.
Again, the matters there that have been raised are being dealt with by the appropriate institutions. I mentioned the CCC. The parliamentary committee system has a role for oversight of a number of these functions, including the CCC through the PCCC, the Integrity Commissioner through their...
Parliamentary committees aren't really investigating cultural, like claims of poor culture among public servants.
Well, I don't think that the claims that have been made amount to evidence of that, and so what we have to deal with is not, yesterday David Crisafulli said he had a thread. He's talking about a vibe. Well, you can't investigate the fact that the Leader of the Opposition has some mud that he wants to throw, but with no new evidence. And if he had new evidence, he would refer it to the CCC. The CCC is a standing Royal Commission. We don't need to set one up, we have one.
Isn't an independent inquiry an opportunity, though, for such evidence to come to light?
Exactly, Jack, and that's the role of the CCC. The CCC is an independent organisation there every day to investigate the government, and if anyone has new evidence, they should forward it to them.
Former Legal Services Commissioner Bob Britton has also backed calls for an integrity inquiry. How do you explain that all these people are saying the same thing, that your government has an integrity problem?
Well, again, my understanding of the facts of that situation was that the former Legal Services Commissioner was unhappy with the composition of a panel to select the ongoing Legal Services Commissioner. He did not agree that the Law Society and the Bar Association should be involved in that recruitment process. His argument was that they should not be involved because they may have to appear before him and that might create a conflict. The Attorney General, the then Attorney General, considered that matter very closely. She sought the advice of the Integrity Commissioner and resolved that those important institutions should be involved in the recruitment process. It is common practice for the attorney to consult with those organisations when selecting judges, even though their members and their representatives will be called upon to represent their clients in front of those judges, and the attorney determined that that was appropriate.
Deputy Premier, it's okay for either your government to do it publicly or behind closed door to question people's character, and there's always two sides to a story, but would you agree that from the public's eye, that these public servants that have come forward to make these claims wouldn't just be doing it to appease David Christofouli? Because if you think about it, what they're doing publicly goes a long way to harm them in the future of any type of employment. As an employer, all you have to do is Google these people's names in the future to find out what their past is. They are putting a lot on the line by making these claims, and that's why you could probably appreciate why the public wants some more answers.
Well, as to the question of their motives, look, they're questions you'd have to address to them. The matters that have been raised either have been or are in the process of being investigated. If they have new matters, they should bring them forward. But as to the question you've asked about what the public expects, well, what the public is talking to me about at the moment is staff shortages at grocery stores and making sure they can get food, access to rapid antigen tests, getting back to school next week. The disaster that is what is happening in aged care right now. More than 1,000 nursing homes with active COVID outbreaks. That's what the public is talking to me about.
Do you think that Mike Summerall, Bob Britton and Nicholas Steppenov are throwing mud and are their claims hyperbole?
I was referring very specifically to the Leader of the Opposition and...
No, but what about their claims? What do you think?
Well, their claims appropriately have been or are being investigated, and that's the appropriate thing.
How can Queenslanders trust the assessment of Mike Summerall's claims by the Director General of the Premier's Department if there's no guarantee the findings will be made public?
Look, I'm not going to reflect upon the investigation that the Director General is undertaking. Questions about that process can be directed to her. As I said earlier in the week, the Director General of DPC, I know to be a public servant of the highest level of integrity and honesty, and she will do a very thorough job, as she's been asked to do by the Premier.
Will the government accept all the recommendations that will come from that review?
We generally do, Jack. You've seen us receive a lot of reviews and a lot of recommendations, and nearly always we accept those recommendations either in full or in principle.
Do you think the LNP's backyard is as clean as they say it is? And you know, politics is a dirty game, and talk about flinging mud. What would you say to David Christofouli and to the way he's leading his party?
Look, I think, frankly, he's going to jump the shark the last week or so. I saw his press conference yesterday, not a single new fact, not a single piece of evidence, just mud and hyperbole, hysteria and histrionics. The fact is, we know that in government, ministers who are currently members of his own integrity team misused private email and destroyed public records. Now, that is on the public record. The fact that Jared Blay used private email and that his office destroyed public records, that is a fact, that is in the public domain, and that has come from them. So, look, David Christofouli will stand up, he'll do it again today. An hour or so, he will stand up, he will throw a lot of mud, but there will be no evidence to it. His Tim Mander, at the press conference yesterday, admitted that he had made so many vexatious allegations to the CCC that he had lost track of which had been investigated, which had been finalised, which he had been written to about. And he has letters finalising matters that he continued to talk about yesterday.
This is the Premier's electorate
Yes.
Not a significant enough announcement for local media to come out?
Oh, look, the Premier has had press conferences this week on Sunday, Monday, Tuesday, Wednesday, Thursday. She announced Tony Fitzgerald and his review of the CCC. She announced the back to school plan. She visited 3 brand new schools that our government is opening. She has fronted the media a lot this week. She chaired the COVID teleconference this morning at 9 a.m. But I think, as you might appreciate, the Premier has a lot of other jobs to do too.
But this is also the day the terms of reference meant to come out for Rachel Hunter's inquiry. Surely the Premier would want to give that some weight and announce those terms.
Well, look, I'm not across when they will be released. I do know that she has given press conferences 9 out of the last 11 days, 20 of the last 34 days. It's not unusual for the team to hold press conferences as well. You'd be aware that over the last couple of years it's been quite common for that to occur, and I don't think there's anything unusual here.
An internal Queensland Fire and Emergency Services report obtained by ABC News cast doubts on police findings that a cigarette started within a borough bushfire in 2019. Do you think this needs further investigation?
Well, look, specific questions about that fire and that investigation really should be directed to the Emergency Services Minister and or his agency. I understand the Inspector General for Emergency Management stands by their findings. The police have made findings there too. I know that all of our emergency services, including in this case the Fire and Emergency Services, QFES and Rural Fire, always do their very best to protect Queenslanders, Queensland property. In the case of fires like this one, they are the true heroes, but any specific questions about that report will need to be directed to those authorities.
Is it fair to say that its own investigation report contained evidence firefighters let the fire spread after having it contained, contradicting the government's claims that they managed the fire effectively? What do you say to that?
I'm not going to stand here and question the way our firefighters deal with a fire in the field. They are the best in the world at that, and I'm not going to question what they do day in, day out. I think they do a fantastic job.
Premier, I'll go back to COVID. Never would you be so happy to get a COVID question. Could I just ask, on what Ben asked the Chief Health Officer, we are a little bit worried, or the government is a little bit worried about that, the term fully vaccinated. There may well be a national plan that the Prime Minister comes up with, but if when you're talking through Cabinet, would you put the recommendation through that maybe we should then put the term fully vaccinated to having that booster and make it mandatory for people to come forward?
Look, that's something we would have to consider if and when that decision was made at a national level. I've got to tell you what I'm most focused on right now is what's happening in aged care. What's happening in aged care in Australia right now is nothing short of a national disgrace. And the Prime Minister ruling out the involvement of the Defence Force in recent days to bolster staffing there was a real shame. I welcome Peter Dutton this morning contradicting the Prime Minister and saying that the Army will be available in aged care. We have elderly residents locked away, isolated in their rooms, not being bathed, not getting food, not getting the medical care that they need, and the national government should be doing absolutely everything they can to change that, including getting them boosted. If they were boosted, we wouldn't be experiencing nearly the level of deaths that we are, and it's there's just no explanation why so many people in aged care are double vaccinated but not boosted when the Prime Minister said that they would be. There's more than, as I said, 1,000 nursing homes experiencing a live outbreak right now, and the staffing shortages that they are experiencing due to staff having the illness or being direct contacts and in many cases unable to access rapid antigen tests. There is a lot that needs to be done. Can I also, in welcoming Peter Dutton's announcement this morning, acknowledge the role that the Today Show played in pushing for that outcome? I don't think we would have achieved it without the scrutiny they provided.
Did it break your heart to see those
child who died from COVID this week from COVID are blaming the Premier for opening the borders too soon. They didn't, saying that there wasn't enough time to vaccinate children. Did the government do enough to protect vulnerable children?
Well, we opened the borders according to the Prime Minister's national plan. We were unaware at that stage that the country lacked the rapid antigen tests that the national plan relied upon. You'll recall that we set vaccination targets. We achieved those targets as a community and together. In some ways, if you look at the management over the, say, 2-year period, that was the best we could hope for, that we would have had a vaccine, a majority of the population vaccinated. That's where we got to, and we achieved that. Obviously, though, the fact every single death, every single Queenslander who dies is a tragedy, and my heart goes out to that family.
Children weren't vaccinated by that point, and obviously WA's managed to keep its borders shut, still being a Labor government. Maybe it should have been a few more months.
Yeah, well, I mean, the border between Queensland and New South Wales is a very different border to the to the eastern border of Western Australia. We made decisions throughout based on the best health advice. We did so in December. We followed the Prime Minister's national plan, and we continued to work to ensure that our health services can take care of Queenslanders who get this virus.
Did it break your heart to see those stories on the Today Show from Christina Hearn, obviously in that aged care sector? And to your knowledge, is it happening in our backyard? Do we know if there's been any horror stories of such magnitude?
It does break my heart. You know, older Australians locked away in their rooms without the care that they were promised, the care that they need. Certainly, we do hear reports of that occurring here in Queensland. We have been called upon to assist. It shouldn't have come to this. They should have all been boosted, and the Commonwealth Government should have ensured that there was sufficient PPE and rapid antigen tests, and I welcome their decision finally today to make the Defence Force available to bolster our aged care workforce and our aged care sector. It's late, but it's welcome.
Let's Dr. Gerard, a quick question.
Sure.
You foreshadowed that there might be an increase in cases when school returns next week. Should families be exercising some caution around visiting their older relatives over the next couple of weeks?
I think probably the main thing is for all of those involved who are eligible for boosters to get boosted. So if they have older relatives, they should get that third dose. I don't like restrictions. I don't like stopping family from meeting. I don't like the idea of children not being able to see their grandparents. I think I would be focusing more on grandparents getting that third dose of vaccine. Obviously, if any child is sick, anyone in the family is sick, they need to stay at home immediately and get tested. And we have the capacity in our health services to test any child who has the mildest of symptoms, because we do know that children's symptoms do tend to be mild. But I do not think we should be restricting children from seeing their grandparents. I would prefer the grandparents got that booster.
Thank you.
Wellcare opens tomorrow, taking its first influx of people. Did you have any comment about that?
Yes. Oh, Dr. Gerard, can you say something?
Oh, maybe I'll hand it over to you.
Please, to see it finally, up and running.
That's right. A lot of work's gone into getting for Queensland a dedicated regional accommodation facility. We're expecting the first guests to arrive tomorrow on an Air New Zealand flight, and we will gradually expand the number of cabins in use there. You'll recall all of the debates about why it was important to be able to phase out of hotel quarantine and have a dedicated facility, and I'm certainly pleased to have it now.
Thank you.
Thank you.
If you don't want any more overlay, then
Don't steal them.
Yeah.
I'm not sure I trust these guys.
Mate, it's better than our salary cell.
We should do a photo anyway.
What time is are you going up there for a pick fact tomorrow?
No, we were thinking of Monday, I think. Or Tuesday.
Probably